unfortunately. In the U.S., the average total cholesterol now is down to about 200. This diagram shows the pounds of food that can be produced on an acre of prime land. One can produce 40,000 pounds of potatoes on 1 acre. 40,000 pounds of onions on 1 acre. 30,000 pounds of carrots. 50,000 pounds of tomatoes and 60,000 celery. But only 250 pounds of bovine muscle. So it's relatively selfish to be eating all of this. John Robbins has said that less than half the harvested agricultural acreage in the USA is used to grow food for people. The majority of it is used instead to grow livestock feed. It takes 16 pounds of grain to produce a pound of feedlot beef. It takes only 1 pound of grain to produce a pound of bread. To feed one meat eater for a year requires 3.25 acres of land. To feed one vegetarian for a year requires half an acre of land. The livestock population of the U.S. today consumes enough grain and soybeans to feed greater than 5 times the entire human population of the USA. We feed these animals greater than 80% of the corn we grow and greater than 95% of the oats we grow. John Robbins says the foods that are the healthiest for the human body are also the healthiest for our environment and create the least suffering for all other creatures. Now, this is what I see a lot. You don't know it, but that's a heart. It's covered by so much fat, it would float down the Persian Gulf here. The entire surface is covered with fat. 50% of the heart transplants done in my institution are in people that are so overweight that their heart floats in a container of water. Now, there's a great deal of problems with obesity, as we all know. Hurts our joints, it hurts our heart, it hurts our pancreas, it produces the common cancers, the kidney stones, brains don't work quite as well. Overweightness is getting to be a world problem, of course. Half the adult populations of Brazil, Chile, Colombia, Peru, Uruguay, Paraguay, England, Finland, Russia, Bulgaria, Morocco, Mexico, and Saudi Arabia are overweight or obese. In China, obesity increased sixfold in the 1990s. In Japan, 20% of the women and 25% of the men are overweight. In some South Pacific islands, 75% of the adults are obese. We all use the body mass index. I think it's a wonderful thing. The problem is a third of the adults in the USA are 25% or less. That's considered ideal body weight. 2/3 of the people, the other 2/3 are overweight, including half of them who are considered obese. Unfortunately, the higher our body mass index, the sooner we die. And it doesn't matter whether we're a woman or whether we're a man. The more we weigh, the sooner we die. This is a study we did at Baylor University a few years ago, back in a 2-month period. We just took the body mass index of all people coming to cardiac catheterization because they were believed to have coronary disease. And it turned out that only 28% had a body mass index of 25 or less. All the others were either overweight or obese. As everyone knows, if we look at body mass index here on the horizontal axis, type 2 diabetes, the more we weigh, the greater our chance of having type 2 diabetes. Hypertension is in blue, and the more we weigh, the greater our blood pressure. And the red, hypercholesterolemia, doesn't work quite as well. A day in the life of a diabetic. In the U.S., 2,220 patients per day are diagnosed with diabetes. Over 500 die every day. Over 150 have amputations every day. 76 start dialysis, and 49 go blind every day. And we wonder why our medical bill keeps flying up there. Now, this is a slide which has to do with cancer of the breast and the relation of cancer of the breast to the fat consumed by various countries around the world. On the horizontal axis is fat. Now, the USA is right up here. We're a little over 140 grams of fat consumed per day by adults in the USA, and we have one of the highest frequencies of cancer of the breast in the world. This slide has to do with the risk of colon cancer, also compared to the quantity of fat consumed by adults in these various countries. In the USA, we're right up here. We're about 140 grams of fat consumed a day, and we have one of the highest frequencies of cancer of the colon in the world. This slide has to do with prostate gland cancer, also related to grams of fat consumed by peoples in various countries. USA is right up here. We consume one of the highest quantities of fat in the world, and we have one of the highest frequencies of prostate gland cancer. Although heart disease gets less attention than certain cancers, in the USA, heart disease still is by far the biggest killer in women as well as men, and it's much higher than these various cancers. I show this slide because Weston Price was a dentist in private practice in Cleveland, Ohio, and he wrote this book in 1939. And for the previous 10 years, he and his wife had traveled the world, spending 2 months a year studying populations and primarily studying their teeth. And what he found, and this is a fascinating book, is that societies whose diet was mainly plant-based had beautiful teeth, plenty of room in their mouths for teeth. But as soon as they switched to processed foods and eating a lot of flesh, and look what happened to their teeth. This is my last slide. In conclusion, we need to go to a more plant-based diet, and if we did so, there would be less atherosclerosis, there would be lower blood pressures, there'd be less frequency of our most common cancers, breast, colon, prostate gland. There would be much less Type 2 diabetes, obesity would not be a problem. Peptic ulcer would go down. Constipation, hemorrhoids, diverticulosis, appendicitis, irritable bowel syndrome, hiatal hernia would be much less. Gallstones, kidney stones, much less. Look at this, ladies, osteoporosis. The more protein we eat, the more bone we lose, the more calcium we lose in our urine. And osteoarthritis also. Thank you very much for your attention.